Okay, so hi everyone. Thank you for joining us for today's event, Canadian Alcohol Policy Evaluation Results for Saskatchewan, presented by Dr. Tim Naimi, Kate Ballance, and Elizabeth Farku. For your information, all participants' microphones are muted today. If you have any questions, we ask that you please use the Q&A box that is located in the bottom center of your Zoom Windows taskbar. A chat box is available if you have any comments or technical support questions during the presentation. As a reminder, this webinar is being recorded. However, the Q&A portion of the presentation will not be recorded. The recording will be available on the Saskatchewan Prevention Institute's website and will be emailed to you in the coming days along with the presentation slides. My name is Laura. I'm the FASD Research Coordinator with the Saskatchewan Prevention Institute. The Saskatchewan Prevention Institute is a provincial organization. Saskatchewan is located on Treaty Lands 2, 4, 5, 6, 8, and 10, and the traditional lands of the Métis. We acknowledge that our work is carried out for and with people from these lands. We are committed to working towards reconciliation and strive to reaffirm our relationship with one another. Our organizational focus is to help all children thrive through primary prevention and the promotion of well-being. We believe that all children, regardless of ability, have the right to the best physical, social, and emotional health possible. We provide education, training, and capacity building across 6 main program pillars: early childhood mental health, perinatal and infant health, sexual and reproductive health, prevention of child abuse and neglect, prevention of child injury, and prevention of fetal alcohol spectrum disorder, or FASD. The FASD prevention program works to provide evidence-based information on topics related to alcohol use and FASD prevention that is accessible to service providers and communities. We have 3 presenters with us here today: Dr. Tim Naimi, who is currently the Director of the Canadian Institute for Substance Use Research, a professor at the University of Victoria's School of Public Health and Social Policy, and co-principal investigator on the CAPE project. He is a physician and alcohol epidemiologist who trained at the U.S. Centers for Disease Control and Prevention and co-founded the alcohol team. Tim's research interests include substance use epidemiology, particularly binge drinking, youth drinking, and health effects of low-dose ethanol, and the evaluation of alcohol policies for preventing and reducing alcohol harms. Also joining us is Kate Ballance, a research associate at the Canadian Institute for Substance Use Research. Her works involve project management and knowledge translation for the CAPE project and a variety of other alcohol and drug research projects on topics such as data monitoring, managed alcohol programs, alcohol policy implementation across Canada, and alcohol warning labels in the Northern Territories. We are also joined by Elizabeth Farku, who is a researcher at the Canadian Institute for Substance Use Research and a medical student at the Mayo Clinic School of Medicine. She's also an active member at the Toronto Cancer Prevention Coalition Alcohol Working Group. Elizabeth has contributed to a review on the effect of alcohol policies on suicide, an educational curriculum on alcohol and cancer for middle school students, as well as the World Health Organization's Global Information System on Alcohol and Health. Thank you all for being with us here today.
Thanks for having us.
I will pass it on to you.
Okay, great. Thank you. It is great honor for us to be with you guys, and thanks to the Saskatchewan Prevention Institute for having us. And Laura, thanks for your nice opening remarks. Next slide, please. So first, we have a land acknowledgement. We want to acknowledge and respect the Lekwungen peoples on whose traditional territory the University of Victoria stands, and the Songhees, the Esquimalt, and Wasanic people whose historical relationships with the land continue to this day. It's particularly important in areas around substance use because of the way that Indigenous folks have been affected by substances and how the role of substances, and particularly alcohol, in colonization. Next slide, please. So this is as Laura mentioned, this is the CAPE project, Canadian Alcohol Policy Evaluation Project. We love to acknowledge our funders and supporters, both because we're thankful and we are always hopeful of getting more. So those are Health Canada, the Public Health Agency of Canada, and then of course we get a lot of in-kind, meaning for free funding and support from our great network of co-investigators and knowledge users and government stakeholders. Next slide, please. So today we're going to give a little bit of a CAPE overview. and the rationale for our different, what we call them, policy domains. And then we're going to focus right down on Saskatchewan, and we're going to talk about Saskatchewan-specific results from the CAPE project and recommendations. And I believe that you guys were most interested in three of those 11 domains, which would be marketing and advertising controls, minimum legal drinking age, and health and safety messaging. Next slide, please. But before we proceed more from our sponsor, we like to say, what is, for those of you who aren't familiar with CAPE, what does it offer? Our intention, and I hope we do that, is that we're offering accessible, evidence-based, up-to-date information for policymakers, both about what there is in terms of policies and what could be. Second, we offer systematic policy comparison between Canadian jurisdictions. Number 3 is we are a platform for informing the public about effective policies. Number 4, we're a mechanism for keeping public health approach to alcohol policy on government agendas. That's extremely important and is really tough these days. And then we have a national community of practice with currently more than 400, I think almost 450 members now from all provinces and territories that are engaging in learning events and knowledge exchange. And again, thank you so much for those of you who are a part of that. Next slide, please. Well, before we like to talk about alcohol policies, we like to remember why we care about them to begin with. And that is that alcohol consumption, even though it's legal and even though it's widely practiced and accepted, nonetheless, it's causes lots of problems. So if we think about Saskatchewan, people in Saskatchewan consumed the equivalent of 463 standard drinks of alcohol, that is with 14 grams or 13.5 grams of ethanol per person age 15 plus. I always like to remind people that that's the average across all people age 15 and older, including people who don't drink, including all the people who drink like once a month have a drink. So that's almost a drink and a half a day. But again, if you restrict that to people who drink alcohol, it rapidly jumps up a lot more than that. And that's just more sort of the also official consumption, i.e. alcohol that's sold through standard means. In terms of harms, that's the second bar. Each year in Saskatchewan, alcohol causes about 636 deaths, about close to 5,000 years of productive life lost, because a lot of the alcohol-caused deaths occur in young and middle ages and not just older age, and about 35,000 hospital admissions. Now, on the right there is what we like to call the alcohol deficit. We're going to learn more about this on the next slide. But, alcohol's economic cost to Saskatchewan in 2020 was $766 million. That's a large figure for a relatively sparsely populated area. And I might imagine that if you look at the total cost of all substance use across Saskatchewan, the cost of alcohol is the highest, and it accounted for 41% or nearly half of all substance use related costs in Saskatchewan. And then if you go to the next slide, we can actually look, because in many provinces and territories, and I'm disadvantaged coming from the United States, but in US states, you always hear, the reason why we need to keep the bars open later or have, start selling alcohol everywhere is that alcohol is so wonderful for the economy. And that may be true for the, for the bar industry, but if you look across the economy and the costs associated with alcohol, there's a deficit in Saskatchewan each year of approximately $312 million, or about 71 Canadian cents for each and every standard drink sold in Saskatchewan. So taxpayers are actually getting the shaft when it comes to economic value and the sale of alcohol. Next slide, please. Well, I could tell you what's happening with alcohol policy, but you probably have a sense, and that is that it's become less restrictive over time. We saw when COVID came, the WHO recommended tightening alcohol regulations. Of course, the opposite happened. Alcohol was just one of the few commodities that was deemed essential by the government. And we've seen the expansion of, particularly for a lot of rollback of policies, like a 20-year wish list of the industry. So we've seen expansion of, and I'm not talking just in Saskatchewan, but across Canada, we've seen expansion of alcohol sales into grocery and convenience stores. We've seen expansion of trading hours. We've seen now that alcohol delivery by third parties is widely been expanded. And we've also seen the continuing increased privatization of alcohol sales, which is generally not great for public health, in Saskatchewan being an unfortunate example of that. Next slide, please. So very briefly, I'm just going to give you a very highlight of how do we get the CAPE results that we get. So the step one is what we call developing a scoring rubric. So we select policy domains, and then and I'll show you an example, but within each of those domains, we will select indicators. So that might be for policy domains, it would be pricing policies. An example of an indicator would be like, how high are the excise taxes, or that sort of thing. Then we weight the domains because we understand that not all policies are equally impactful. And then, so once we do that, then we kind of say this is what each policy should be worth. We review that with outside experts also, in addition to our own in-house experts. And then we come up with our final scoring rubric. Then we collect policy data collected it across all the provinces and territories over the same time period. We validate that information with government officials from relevant departments. Then we add up the points, and then we get the scores. Next slide, please. These are the CAPE policy domains. Just again, for background, we're not going to be talking about all of them. We're just going to be talking about the three with the orange stars next to them. They're arranged in descending order of total impact, so the ones that have the most evidence of effectiveness and also affecting, a wide percent of the population. So today we're again talking on marketing and advertising controls, the minimum legal age, and health and safety messaging. Next slide, please. Oh, and I think that is my cue to turn it over to Elizabeth Barku. Thanks, Elizabeth.
Thank you, Tim. So I'll just be going over the scores across Canada. So we can see that the average CAPE scores across all the provinces and territories was unfortunately 37%, and the highest score was 44%, and that was in Manitoba. Saskatchewan scored 36%, which is only just slightly below average. Next slide. So the CAPE scores that we just presented on reflect the performance of each province and territory according to the best practice for alcohol policy as captured in our rubrics. But it's worth noting that these are pretty tough standards. So we also analyzed the policy data to see what score could be achieved by any jurisdiction if they were to implement all the best or the near best practice policies that are currently in place somewhere else in Canada. So these are the best practices not as judged by the CAPE team, but in relation to provincial and territorial peers. So we call this the best existing policy score comparison. So if Saskatchewan implemented all of these, it would result in a best existing policy score of 80%, which is an A-. And so the real important point here is that really good alcohol policies are achievable by adopting best practices of other provinces and territories in Canada. Next slide. So here are the policy domain scores for Saskatchewan. You can see that unfortunately, nearly every domain received a failing grade, with the exception of screening and treatment interventions, which received an A-. So not a terrible score in that domain. Next slide. So I wanted to take a closer look now at the results for Saskatchewan for 3 of the CAPE domains. So marketing and advertising controls, I will touch on, Tim will touch on minimum legal age policies, and then Kate will go over health and safety messaging. Next slide. So we know that one of the best ways to reduce and prevent the harms caused by alcohol is to have regulations that limit how, when, and where alcohol can be advertised. So these regulations should control how much advertising there is, what the ads can say, where they can be shown, and how alcohol's prices are promoted within the advertisements. The regulations should apply to everyone who wants to advertise alcohol, and there should be an independent authority to ensure that these regulations are adhered to. And we can see here that regulations are important because, as you can see in the image on the bottom of the screen, this is from the Toronto transit system, and essentially the entire streetcar is covered in alcohol advertisement. And this is a place that many young people frequent to travel from A to B. So it's very important that regulations exist for this reason. Next slide. So the alcohol industry is always looking to expand its marketing strategies in order to increase sales and recruit new customers. So the developments of products designed and promoted specifically for the female market allows alcohol companies to attract new consumers and increase their profits at the same time. And it's important to keep in mind that the more alcohol is consumed, the more harm that individuals, families, and our broader communities experience. So first, I want to touch on the impact of alcohol marketing towards mothers as an area of concern. So this type of marketing perpetuates ideas that busy mothers should use alcohol as a form of self-medication or stress release. And alcohol sold under the branding of mom juice, as shown here, or mommy meltdown, as shown on the right-hand side. These are just some examples of this type of advertising. Such marketing preys on vulnerable populations and normalizes alcohol as a culturally acceptable way of managing stress. This serves to only further exacerbate mental health concerns and can contribute to alcohol use disorder and other alcohol harms such as cancer. And this leads me to my next point, which is regarding pinkwashing. So pink washer, the definition as shown here, is a company or organization that claims to care about breast cancer by promoting a pink ribbon product, but at the same time produces, manufactures, or sells a product that is linked to the disease. So we know that alcohol has been classified as a group 1 carcinogen, with the link between alcohol and various cancers, including breast cancer, being very strong. Group 1 is the highest class you can achieve in terms of level of evidence. And still, alcohol companies capitalize on pink ribbon campaigns, portraying themselves as caring about the cause, while at the same time they are actively contributing to the disease burden by selling a product known to cause cancer. And so you can see here on the bottom left of the screen, that's just one example of, there are numerous, and it just takes a quick Google search to find many other examples of pinkwashing of alcohol products. So it's ironic because they are contributing to risk in the name of prevention. And it's very odd and very unfortunate because implicitly many consumers may associate alcohol with improving cancer cure or something like that, when in reality, alcohol is increasing the risk of cancer. And finally, I just want to touch on FASD, which is fetal alcohol spectrum disorder. So we know that alcohol use during pregnancy is another serious concern, as it's a leading cause of preventable birth defects. So reducing alcohol during pregnancy will reduce the prevalence and severity of FASD. And as such, reducing alcohol marketing targeted towards women of childbearing age is one key strategy to prevent the severe and lifelong impacts of FASD. Next slide. So here on the screen are just some more examples of alcohol marketing targeting women. And with the female-focused marketing, we see a focus on slimness, weight, pink packaging, glitter, messages of sisterhood, all-female friendships, and motherhood. And gendered tropes like the color pink in combination with signals of sisterhood and hard-earned fun are common ways that marketers depict women drinking. And this is concerning for a few reasons. One is peer pressure. So we know that when alcohol companies target women, they emphasize messages of sisterhood, all-female friendships, and motherhood, which perpetuates beliefs that drinking is required or expected when interacting with peers. One such example is on this slide on the bottom right. You can see this ad says, "Our new Blush Rose Cider has only 119 calories per bottle, the perfect pairing for your spring Sunday sesh with the girls." And so ads like these can create peer pressure, making some feel like they must drink to fit in or to be accepted by their friends, which we know is a very harmful idea that gets perpetuated by marketing. Another reason for concern is body image and self-esteem. So as I just mentioned, that one advertisement is talking about calories, and this is very common with female-directed advertising. So the alcohol industry's marketing aimed at women often emphasizes the slimness, weight, low calories, and this preys on consumers with body image concerns and leads them to believe that drinking may help in weight loss or weight maintenance, when in reality, alcohol can exacerbate mental health concerns, lead to worsening self-esteem and worsening body image issues. Another reason for concern is underage drinking. So often alcohol advertisements might directly or indirectly appeal to younger girls or women. Often this is with respect to high sugary alcoholic drinks. And this can encourage underage drinking, which can lead to serious consequences for teenagers, including an elevated risk of future breast cancer. So we know that the earlier young girls start drinking, the higher the risk of breast cancer. And finally, it's concerning because often these ads kind of fall under the guise of empowerment. So to appeal to a broader audience, they often may showcase ads under the guise of feminism or other social justice movements. However, this advertising only actually exacerbates harms among vulnerable populations, including women and racial and ethnic minority groups, by targeting these groups through alcohol advertising. This co-option by industry also cheapens the message behind social causes and can stall actual real systemic changes from taking place. So there's a number of reasons why these various types of marketing can be very concerning. Next slide. So looking at the CAPE project and what we measured, so we looked at both advertising restrictions and the enforcement of restrictions themselves. So advertising restrictions, which is this blue box on the left-hand side of your screen, this can include things like the volume of advertisements. So for example, the number of advertisements or the percent of ad space occupied by alcohol ads across all media types. It can include the type of advertisement content allowed. And specifically, we looked at whether there are restrictions that go beyond the federal code for broadcast advertising of alcohol beverages, and that's known as the CRTC code. We also looked at placement restrictions, so restrictions that prohibit alcohol ads near schools or near treatment centers, bans on alcohol ads that are in media that are disproportionately watched by underage individuals. And we also looked at price-based promotions, so the restrictions of things like advertising 2-for-1 deals, for example. The effectiveness of marketing policies is contingent on controls applying to all advertisers and all media types. So in this section, we also assessed whether alcohol advertisements by non-licensees, so this can include third parties not involved directly in the production or manufacturing or sale of alcohol, such as food delivery services like Uber Eats or Skip the Dishes. So we looked at whether those companies were permitted to advertise alcohol. We also looked at whether alcohol advertising restrictions applied to all advertisers, so including government retailers, private retailers, and licensees, ferment on-premise outlets, special occasion permit holders. We just looked at whether they applied to all advertisers. In terms of enforcement of restrictions, that's the right-hand side here in the orange box. So this includes looking at whether there is a mandatory pre-screening conducted by a representative independent from the alcohol industry and alcohol sales, whether there's a specific independent authority responsible for enforcement, whether there is an online complaint system that's adjudicated efficiently, whether there are penalties for violations that are commensurate with the severity of the violation and escalate with the frequency of the violation, and finally, whether there are public listings of violations, which include the advertiser name and the nature of the violation. So these are all things that we considered when we were adjudicating the CAPE scores. Next slide. So here we can see that the average score for marketing and advertising controls across Canada was 33%, so a failing grade, and Saskatchewan scored significantly below average with an 18%. Next slide. So we can also break down this by advertising restrictions versus enforcement of advertising restrictions. So we can see across Canada, Nunavut and Quebec scored highest in this domain for relatively robust advertising restrictions paired with stronger policies for enforcement of advertising restrictions. So as an example, Nunavut has restrictions on alcohol advertising content and placement that requires pre-screening of alcohol ads by a licensing board before they can be distributed to the general public. So lots of restrictions in Nunavut that are a good example. Manitoba also had higher scores in this domain for having an independent online complaint system that was specific to marketing and advertising violations. And an example of a content restriction from Manitoba states that every alcohol advertisement must contain a social responsibility message. There are also requirements such as the requirement that advertisers must not play upon superstitions or fears to mislead consumers. Another example, in PEI, there are restrictions in place that prohibit placement of alcohol ads near schools or in media that are disproportionately watched by youth. So lots of good examples across Canada in terms of this domain. Next slide. So looking specifically at how Saskatchewan performed, so again, that blue bar is the advertising restrictions. So there are no full bans on alcohol marketing and advertising in Saskatchewan. This is regards to ad volume, content, or price-based promotions. There's no restrictions for any of those. There are placement restrictions on websites and other broadcast media, as well as out-of-home advertising for ads that are directed primarily at minors. So that is a positive. In addition, the marketing restrictions do apply to all advertisers, including government retailers, which is a positive. Again, that orange bar represents enforcement of advertising restrictions. So there is no mandatory pre-screening of alcohol ads across all media types and advertisers in Saskatchewan. There is no independent online complaint system that's run independently from the alcohol industry and alcohol advertisers. There's no specific authority independent of the industry that's responsible for enforcement regardless of the advertiser. And there are no specific penalties for alcohol advertising violations. One positive is that there is the presence of publicly available listing of violations. However, it's worth noting that this includes all liquor violations and is not specific to marketing and advertising violations. Next slide. So talking a little bit about how to improve Saskatchewan's score, we recommend that Saskatchewan put rules in place that would limit how many ads can be shown, what specifically can be shown in the ads, where they can be shown, and restriction of promotion of discounts for all advertisers, even those who aren't officially licensed, such as Uber Eats, Skip the Dishes, those third-party delivery services. In addition, we recommend Saskatchewan apply these rules to all kinds of ads. So that includes ads on the TV, internet, public spaces, and other areas. And we also recommend Saskatchewan choose an organization that's not connected to the alcohol industry that ensures that alcohol advertisements comply with regulations. Specifically, ads should be pre-screened before they're made public. Complaints should be able to be made online very easily by members of the lay public. Advertisers should face penalties for violating regulations, and penalties should be larger and more severe for repeated and more severe infringements. And it's worth noting, going back to that best practice idea, that if Saskatchewan implemented all the best existing marketing and advertising policies across Canada's provinces and territories, the score could increase from an 18% to a 72%. So lots of room for improvement if Saskatchewan simply looks to other provinces and territories to see what their best policies are. And with that, I will hand it back over to Tim Naimi to talk about minimum legal age policies.
Thanks, Elizabeth. Okay, minimum legal age is a quick overview. Minimum legal age laws offer health and safety benefits at the population level. They do a couple things. They reduce, of course, even in the absence of really much enforcement at all, they actually have a big impact on reducing drinking among young people. And perhaps equally or more importantly is that you see, like in the US, where higher age limits were introduced over time, you can see effects across the lifespan because the way that people drink at young ages is highly predictive. So you want to delay the onset of starting to drink, and then that changes the trajectory over the life course. So that's even in the absence of good enforcement. They can be strengthened with proof of age laws that require anyone purchasing alcohol to present identification, ideally government-based identification. And there's lots of variation in minimum legal age laws across Canada. Next slide, please. So what did we measure with our minimum legal age thing? So on the blue on the left, we've got the minimum legal age for the sale, purchase, or possession of alcohol. That is by the young person in question. So sale, purchase, or possession. And then, is there any legislation prohibiting third-party purchase or provision of alcohol to minors? This is actually more important than the first bullet because, contrary to popular belief, most kids do not get their alcohol by stealing it, either from a store or their parents. Most of it is provided, either sold to them or given to them by people who are of legal drinking age. And so really just instead of focusing just on kids, this is about what's called in the US typically furnishing to minors. Is that prohibited? And then within furnishing to minors, are there any exceptions that allow for parents, legal guardians, or spouses to provide minors with alcohol outside of private residences? I mean, in most places, people can do what they want in their own homes, but this is looking for exceptions specifically outside of private residences. And then the other big component of our measure for minimum age is the proof of age verification. So is there a requirement of proof in terms of a government issued photo identification for all individuals purchasing alcohol, not just people who look like they might be of a certain age. We can talk about why that doesn't work. And then is there a two-stage proof of age verification project for sales that are made remotely? In other words, when you order the alcohol online, you have to provide proof of age, and then when you receive the alcohol. Next slide, please. Here's Saskatchewan's score. The average score for this policy across all provinces and territories is 25%. Next slide, please. Saskatchewan did a bit better. So now in terms of the minimum legal age, which is 19, so Saskatchewan, BC, Ontario, Nova Scotia, Newfoundland, and Northwest Territories have the highest scores because they all have a purchase age of and possession age of 19, with no exceptions in terms of furnishing. In terms of that's the blue bar. And then if we hit, is there an orange bar that's supposed to appear? There's an orange bar that's supposed to be next to it, but no, there's no jurisdictions currently have mandatory proof of age policies requiring that governments issue photo identification by all individuals. I think that's because there is, everyone got a 0 for that. That's why there's no orange bars. Next slide, please. So Saskatchewan has a minimum age of 19 and does not have any minimum legal age furnishing exceptions, as we mentioned. And this table just shows some examples of some of the exceptions to the minimum legal age in other Canadian provinces and territories. You can just get a sense of that. We'll go ahead with the next slide. So how to improve Saskatchewan's score? Well, this says increase the minimum legal age to 21. That would be the best practice based on evidence that has the most evidence of impact. But increasing the age at all above 19, even to 20, would be good. I understand that the political likelihood of that happening is low, but that would be the most important thing. And remember, even this is a policy that actually doesn't depend on a lot of enforcement, and what enforcement occurs would be among adults providing it to alcohol. There's also some other ideas short of increasing the age, which would be to consider granting graduated access to alcohol. So in other words, have more stringent age requirements for purchasing higher strength alcohol, or perhaps, at later hours of the day or the night. And then the idea is to require proof of age identification to anyone purchasing alcohol, and two-stage verification for alcohol sales remotely. The reason why the current practice is to say, oh, if someone looks under age 25 or they don't have any guidance at all, is that as long as the person who's selling the alcohol, all they need to do is say, oh, I thought the person looked under age 25, and that business will never get cited, essentially. So you have to just make it mandatory age verification for everyone in order for those to work well. Next slide. I think that's turning it over to Kate now.
Yeah, thanks, Tim. That was great. So I'll just give a bit of an overview on health and safety messaging. And these messages are about alcohol. They can be found on alcohol product labels, signs or posters in stores, or in restaurants and bars, or in outdoor campaigns, so billboards or on buses and online. These messages give important information to help people make informed choices about drinking alcohol or whether or not to drink alcohol. So for example, labels on alcohol containers might tell you about how drinking alcohol can lead to cancer or other long-term problems or chronic health issues. And many people in Canada may not even know yet that alcohol can cause cancer, 7 different types at least at this point. And this kind of messaging might also say how many standard drinks there are in that beverage container. So you could have a bottle of wine that is 12% alcohol, and you could have the same size bottle of wine that is 14% alcohol. You're going to actually have more standard drinks in the 14% because it's a higher percentage of alcohol. So when you pick up the 2 bottles, you think, oh, this is the same number of drinks. In terms of the ethanol content, it's actually not the same because of that higher percentage. So that's also important for consumers to know, because it means that they're getting more of the ethanol, which is what is the carcinogenic component of the beverage. So campaigns about alcohol run by government health agencies are trusted by people almost as much or the same as advice from doctors. And so these campaigns can be really effective, and they're seen as reliable because in the, in your Ministry of Health, your health departments, they don't have necessarily those same hidden interests or vested interests from the alcohol industry or other organizations that have links to the alcohol industry that might be, trying to convince you of something else. Next slide, please. So here are just some examples of some different types of product labeling and awareness campaigns that could be considered health and safety messaging. So on the top left are some warning labels that were put on alcohol containers as part of a study up in the Yukon a couple of years ago. And you can see that one has a cancer warning, and then the previous national guidance for drinking guidance. The bottom left is a poster from an online campaign about alcohol and cancer that the BC Cancer Society put together with the BC Ministry of Health and also with the BC Centre for Disease Control. And it was called the Proof campaign. It was quite clever. And then in the middle are some labels that were actually put on alcohol containers in Saskatchewan. And again, those have Canada's previous national drinking guidelines on them. And then on the right is a poster from the Saskatchewan Prevention Institute that is about the risks of drinking while pregnant or trying to conceive. Next slide, please. So for the purposes of our evaluation for CAPE, we looked at 3 different components of health and safety messaging. The first in blue is the status and quality of product labels and whether there is any legislation in place that allows for a government to require mandatory warning labels on alcohol containers. And if there already are labels, so like there are actually labels required both in Yukon and Northwest Territories, whether they have some of the key components that make for an effective message or warning label. And those are things like health messages, standard drink information, information about national drinking guidelines, and calorie information. And then whether they meet some of the other standards of effectiveness, like being large enough, easy to see, using graphics or pictorials so that they really kind of catch your eye. And then if the labels are developed without involvement from the alcohol industry. So in the middle, in that sort of peachy orange color, we looked at the type of health and safety messaging required on site, so at the liquor store or in bars and restaurants that serve alcohol, and whether it's mandatory to have those posted. And then whether the information in those posters is evidence-based health and safety messaging on a variety of topics. So things like alcohol and cancer, acute injury, violence, youth, impaired driving, that allows consumers to make those informed health decisions about the product. And then in the gray on the right, we looked at whether health departments and ministries are running ongoing health and safety.
We can talk about health and safety messaging in Saskatchewan here. So the blue bar, which you can see is non-existent, is a 0. That represents the status and quality of product labels. So Saskatchewan does not have any specific provincial legislation allowing for enhanced labeling components. And there's no information about health risks such as the risk of cancer, standard drink information, national alcohol guidance, or calories on alcohol containers in Saskatchewan. The orange bar, which again is not shown because it's 0%. So Saskatchewan's, this is on-site health and safety messaging. So Saskatchewan scored 0% for having only voluntary health and safety messaging. It was not evidence-based, not adequate in supporting informed choices, and does not include graphics as well. It's also not mandatory in all instances, and it's only required periodically with no set time frame. There is, however, mandatory signage about minors, which applies to permitted events or special occasion permits rather. The gray bar here, this refers to health and safety campaigns by the health ministry. So there's currently no ongoing health and safety campaigns beyond the Ministry of Health messaging around mental health that's provided by the government website for National Addictions Awareness Week. So there is something, but still lots of room for improvement. Next slide. So in terms of how to improve Saskatchewan's score, we would recommend that Saskatchewan implement enhanced alcohol labeling as a manufacturer requirement, that they require liquor stores and bars to have signs and posters with health and safety messaging that must be prominently displayed. So it's not just important that they exist, but also that people can see these signs and messages. We also recommend that labels, signage, and messaging should include a variety of evidence-based warning messages. These include messages surrounding cancer risks, standard drinks, national alcohol guidance, calorie information, things like that. And we also recommend that these be prominently displayed and be accompanied by pictures, rotate across products so it's not the same message being shown every time, and support consumers in making informed decisions about product use. We also recommend that the Saskatchewan enhance their ministry-led alcohol health and safety campaigns by delivering beyond annual campaigns, so more frequent, and increasing the variation in the topics discussed. So it's worth noting again, referring to that best practice idea, that if Saskatchewan looked to other provinces and territories, their score could increase from an 8% to a 50%, which is a D-. So still lots of room for improvement in terms of provinces and territories across Canada, but I would say that a 50% is a lot better than an 8%. Next slide. So today I just want to talk about the fact that we only talked about 3 policy domains, but Kate covered a lot more than that. So these domains are all important part of health promoting alcohol policy, but they're not enough on their own. So we need policies in other areas as well in order to prevent and reduce the harms caused by alcohol. So for example, pricing and taxation is our highest ranked domain, and that's because it has very high potential impact. And Saskatchewan could improve policies in this area by raising the minimum prices for alcohol, basing the prices on alcohol content. So right now it's based on beverage volume. So for example, a certain volume of beer may have a minimum price of 1, but it's not based on the actual alcohol ethanol content. And that's very important because we want people to be drinking lower alcohol by volume beverages, which would be cheaper under that minimum pricing scheme. We also recommend that Saskatchewan keep prices in line with inflation and raise the alcohol-specific sales tax. When and where alcohol is available is also very important. So strategies such as limiting how many bars or restaurants can operate and where they can be located, as well as reducing the hours during which alcohol can be sold. That is not before 11 a.m., not after 8 p.m. for liquor stores. That's just one example. And this is just a critical area for alcohol harm reduction is the physical availability of alcohol. And in terms of how alcohol is controlled, so that's control system, government agencies who are in charge of regulating and selling alcohol should report to a health and safety focused ministry in order to ensure that their decision-making takes into account the impacts of their activities, and that decision-making on public health and safety is a priority, not just on financial or business-related objectives. And finally, the last example on this slide is the Northern Alcohol Strategy. So this is a strategy that's in place that could be expanded within the province, as alcohol strategies or action plans can help prioritize and coordinate alcohol policy initiatives and interventions of our government leadership. And finally, we just wanted to talk about some opportunities to influence policy. So this is just one example. There's been some growing interest in Canada around alcohol labeling initiatives. So Bill S-254 is an act to amend the Food and Drugs Act. It's also known as the Warning Label on Alcoholic Beverages Bill. And it's at consideration at committee in the Senate as we speak. And there's opportunity for those in support of the bill to write letters of support. If you visit our website, we actually have letter templates that you can use to submit your support for this bill. And so I would encourage you to look at our website if that interests you. Next slide. And that is all for today. Apologize for the technical difficulties. I'm sure that we would all be happy to take any questions that anyone might have. And I see there might be one in the Q&A already. And also the next slide. Yes, thank you. Just wanted to point out as well that we have lots of knowledge products available. So if you're interested in best practice example leaders, you can look at the best practice document on our website. If you're looking at rubrics, those are available on our website. So lots of various knowledge products that could be very useful for folks. If you're interested, please do check out our website.